A very warm welcome to all of you. It's my pleasure to introduce today's guest, Varun Agarwal. Varun Agarwal is the founder of India Migration Now, a migration data and research and advocacy organization. India Migration Now aims to mainstream migration in India's development ecosystem by conducting primary and secondary research, designing evidence-based intervention in migration corridors, and advocating for furthering migration policy in India. Along with strategy and fundraising, Varun's core research and operational focus at India Migration Now is on migration data, designing service delivery mechanisms, and the political economy of migration. Varun has worked on projects around digital financial inclusion, informational privacy, and competition policy. Varun has a BA in Maths from the University of Washington in Seattle and an MSc in Economics from Maastricht University. Varun's lecture today on the Interstate Migration Policy Index is a part of the policy class, and this index was developed by Varun and his team. Varun, we are very excited to have you and learn more about the index. So over to you.
All right. So thank you, Amrita, and it's a real pleasure to present this work to all of you. Today's lecture, I'm going to spend time sort of motivating the importance of migration policy, the theoretical underpinnings of creating a policy index for migrants, especially in the context of internal migrants, low-income internal migrants in India, and also sort of in the process share some methodology on how do you build effective policy indices. I will illustrate the results from the 2019 and then post-COVID 2021 impacts sort of study, and then share some of the results to further motivate how this can be applied and some policy recommendations. I will conclude by sort of showing how you can engage with impacts and maybe talk about the future of impacts, and then Amrita and I can have a little discussion around that. So that's the plan for today. So to get into it, impacts, which is the Interstate Migrant Policy Index, didn't come in a vacuum. It came from engaging with a variety of other policy indexing exercises, especially in the migration space. In this slide in front of you, I've listed about 6 such initiatives. There are more now today. The particular inspiration for impacts came from MIPEX, which is a Migrant Integration Policy Index developed by the Migration Policy Group in the European Union. MIPEX has been a go-to tool for European policymakers to evaluate and design state-of-the-art policies for the integration of non-EU immigrants in Europe. So we, in fact, at India Migration Now, were the country team for India to include India in the international MIPEX initiative. But yeah, MIPEX and the work done by Thomas Huddleston and team at NPG was quite seminal. It provides a framework for doing policy evaluation, policy comparison, and policy recommendations. And I'll get into theoretical underpinnings because we share that with MIPEX. DEMIG is another fantastic, but a different approach, but a very fantastic repository of migration policy changes in the post-World War period. Largely, this is focusing on the OPEC countries, the OECD countries, not OPEC. The OPEC is covered in MIPEX, coincidentally. But DEMIG tracks the changes. It helps you understand the directions that policy, especially entry and exit policies, have taken. So it's not so much integration, but it's more about core immigration policy to the entry and exit of countries. And it helps you understand how they've changed, right? Similar initiatives are the Global Migration Barometer. They're looking at the accessibility and attractiveness for countries for migrants, and it sort of switches the equation. It's helping migrants understand what is attractive and accessible for them versus the other way around, which is how typically integration policies sometimes can work and entry policies can work. Impala is a very law and policy oriented project, which again is a comparative immigration policy. The migration governance indicators were work done by the IOM, and it's used by governments to understand their own policies, and they can understand what some other countries are doing. So it's a great reference tool. And MPIC, again, similar to MyPEX and Impala, is a lot of different indicators to understand OECD countries and their immigration policies. So the point of and this is by no means complete or exhaustive, but it is to demonstrate that policy indexing for the last, I would say, 15, 20 years has become quite a prominent part of the migration ecosystem around the world. But you will notice one gap. None of them are focusing on internal migration. So let me move on then. So now, regardless of internal international migration, there's some core theoretical frameworks that we have to ground ourselves in. The first one, which is in the name, is migrant integration. Now, migrant integration is a core, huge part of migration studies. It is something that really picked up in Europe, especially amongst the member states of the EU, post 2010, as the the Gulf and the Middle Eastern wars escalated, especially in Syria, and then that led to a huge number of migrants and mixed migrants. So people coming in for war, but also economic reasons, but also coming without papers. All kinds of mixed migration phenomena took place into Europe, and that motivated policymakers and a lot of funding into the academic space to understand and study migrant integration. Though migrant integration has been studied for many decades, I would say the last 2 decades, especially the last 10, 15 years, has been where we've seen the maximum amount of work being done. And now the core theoretical work done in migrant integration, and I'll define it for the index in a second, but it's important to understand how integration has expanded from Europe and now is being applied in different settings in Africa, in North America, in South America, and in Asia. So it has expanded out of Europe as an area of study, and it's also very important because it is a very Eurocentric concept, migrant integration, because the notion of integration means that somebody from the outside has to adapt. There's an outside insider kind of implicit assumption, which can be quite problematic because integration happens on both ends. Which takes me to the definition here, that it is about the process of both permanent and non-permanent settlement. How is that process? You're settling in, your entry, your first maybe year. So if you're an asylum seeker, to give an example, seeking asylum can take up to a year. Once you get asylum, your residency, your visa process, your municipality work, your access to other services like welfare. I mean, these are it can take years, right? So it's a pretty long drawn integration process. And this applies for internal migrants also. To get domicile in India, I'm going to talk a lot about domicile at state level, can take 10, 15 years. So, this is a pretty ongoing, sometimes never ending process, and a constant source of lived anxiety for all migrants, right, and their families. But at the same time, it is about interactions with the receiving society, not just the institution, but also the we can talk about CSOs, so civil society organizations, it could be informal groups. All these pieces have a big role to play in the lived experiences, not just the people who are coming in, but also the people hosting them. And then the subsequent social changes, right? And I think we see the political impacts, the ramifications, where even small scale numbers are always exaggerated in discourse, in media discourse, political discourse. But it is even a small change, a small delta of 1 or 2% of outsiders coming in and settling in can change the political fabric, the institutional fabrics, right? So the reverberations of not thinking about integration or badly doing it are immense, right? So this is what we mean by migrant integration. There are many different term, assimilation and adaptation, all kinds of in the literature you will come across, but we use integration because it's been fairly well defined from a policy point of view. And I think that's something to keep in mind in how we think about things, because we are talking about policy implications there. Then the other concept is multi-level governance. This is a lot more fixed, but it's a crucial idea. A lot of our ideas of when we imagine international migration is all about nation states. It's one country to another. The reality is corridors can be city to city, state to state. To give you an example, we do a lot of work in labor migration from India to Germany. And a lot of the actual practical work is happening state to state between Maharashtra and Baden-Württemberg in Germany, right? So we have the mayor of Dusseldorf coming to Bombay. So the point is that it's a multi-level reality. Municipalities, state governments, provincial governments, central governments, I would argue CSOs, NGOs, private sector, all these stakeholders have a role to play. So we're looking at multi-level governance, right? It is not just a single state. And this applies to both internal and international migration. Very important concept, especially when you think about the interstate migrant policy index, right? Finally, mainstreaming, which was actually the heart of where we started, which is the heart of India migration now, is that we're trying to mainstream migration. What does that mean? It means we're trying to build a reflex. We're trying to build an institutional reflex amongst all the stakeholders in the multi-level context I identified, to say that if you're designing education policy, you think about migrants, whether internal or international, whether you're trying to fund or allocate fiscal budgets to, let's say, promote a welfare scheme, you think about not just the local languages that people speak, but also think about the migrants who might be there. It might require a their linguistic to be factored in, right? So these are very practical sort of reflexes that we want people to have, to think about migrant children, to think about labor market access and how restrictive or permissive you are. So these are reflexes which policymakers don't have for various technical reasons and political reasons. We can get into it. But the point is that we're trying to address them through a process of mainstreaming. And this is how you create long-term change in policymaking. It is not always about creating a department for migration. That's sometimes the approach. That is not possible. That is also short-term. And sometimes fiscally and technically not the capacity isn't there. It's better to work with areas that matter to migrants and create these reflexes, which is, again, the motivation behind the Interstate Migrant Policy Index and some of the other indices I talked about earlier, right? Now, to get deeper into this Russian doll, so the migration governance integration policy, right? To get more specific about those things, like I was talking about the EU crisis, migration policy making is immense now. We see in the US, in the international migration context, but these are just the headlines we come across. This is a very active problem in South America with what's happening in Venezuela and the influx into Colombia. Within the African context, this is immense. A lot of migration there happens within Africa. So these are active discussions there. It's increasingly a problem, and it's a genuine problem for countries which are aging, how to integrate, how to welcome people. And then in larger countries like India, it is an internal migration problem and governance. And COVID was, my last point there is about COVID. COVID really revealed the sort of the absence of thought, really, that the absence of understanding about the role of people who are not your residents, your formal residents, but informal residents in your cities. I mean, what happens when you don't understand where they live, where they're from, where they work, their conditions. So then when you had a lockdown, and it's been now depicted very painfully, we all lived through it, that they couldn't eat, they couldn't even achieve the access to basic aid that they needed because, well, institutions didn't know they existed, frankly. So these are why migration governance and things like integration matter so much. It is, just to give you a scale of things, internal migration is 3 times the flow of international migration. And it's probably an underestimate, but there's no attention given to this problem at all. And it's a problem because folks in poorer countries where institutional capacity isn't there, you have issues like COVID when they kick in, and any other crisis, they are the first ones to suffer because they're the most vulnerable in the absence of any institutional protection, right? And And there have been minimal attempts to understand integration in the context of internal migrants, which is still true. I think there's still a global lack of focus on this. And again, this is part of the mainstreaming mission that, this index and the work in India migration that we do are all about. Okay, so just to talk a bit more about internal migration in India, I'm pretty sure this will be discussed in many other lectures, but I just want to just bring in some salient points which are relevant from the index point of view. It is always worth starting with the constitution. I think all of us who work in migration in India love Article 19(1), those clauses, because, well, you have as an Indian citizen, you have a fundamental right to move, reside, work, and settle any part of the country without restriction. It's your right. We know plenty of examples where states actively violate those rights, and it's an active legal problem in the country where the constitution isn't being complied with, right? And it's a political reality where the constitution and the states and some of the other multi-level actors can create barriers. For give an example, during COVID, when there was a scarcity of vaccines, and you had to remember, you had to register with COVID, and there were state-level registration processes. There were some states who said, well, if you're not from our state, you can't get the COVID vaccine, which was a public health crisis to go down that route. And there was immediate movement in courts to push against that, because that was a public health, it was violating the principle of public health. And it's because, well, migrants, if they are in your state, they're working, recognizing their realities, and you're blocking them from their basic right, which was getting a vaccine. So just an example, when the constitution is violated, right? And so internal migration generally in India, and it's because internal migration is driven by many things, but the most prominent in our heads is labor motivations. It's informal. Most of the labor market in India is informal. As you can imagine, a lot of internal migration is also informal. It doesn't happen like through reporting. It's not like people are saying, I'm going to the government and I'm arriving. That's not happening. There are initiatives like that, but that's not what's happening. So it's quite hidden. It's not been a real priority at any stage in policy making in India, except perhaps that moment we had in COVID. But basically, it's a nascent area of policy. Migrant workers are vulnerable compared to native workers because they're migrants, and I think that's sort of an axiom, which I'll talk about the principles of the index, but it's an axiom. And what we have are a mix of some states taking, like Kerala. We'll talk about the work Kerala has done. Focused policy attempts towards migrant integration to provide the services, entitlements, and rights. But a lot of it is accidental. It's just because the national framework somehow were like, the right to education needs to have all children covered. It's not that the states want to do it, because it was just a national accidental kind of integration, which is fascinating to come across in our research. But largely it's a patchwork. Largely, even if it's on paper, it's not been implemented, which is something we measure in the index, and I'll talk about that. And it varies. It varies. Like I said, sometimes central government is doing things, which state governments, sometimes state governments are doing, but district governments and municipal governments are doing. Sometimes municipal government takes initiative, and the others don't. So it's a real patchwork, and which also reflects the nature of policy making somehow in India. I think it's very revealing on that front. At the central level, now it's all labor codes, so this might seem a bit antiquated, but there was something called the Interstate Migrant Workers Act. It has really never been implemented. It was not changed. It was just completely absorbed into the labor codes without much thought. But what that did do, and this is one of the things about impacts, because we are trying to measure policies on paper, is that even on paper, when a policy is enacted in paper, it has power because it's enshrined, it's in the system, and it has strange ways it reverberates across the multi-level governance structure we're talking about. And COVID is a great movement from just that framing point of view. So because a policy, states need to create rules for policy. So even the labor codes, some things which were not being, even rules were not created, the labor codes forced them to create rules. So some of these things were actually implemented 40 years after, they were actually put in place, or 30 years. So the central policies do matter, the point is, so even though we're focusing on state policies. At the state level, one of the key things to understand is that most eligibility, especially welfare schemes and scholarships, anywhere fiscal allocation access matters, because policymakers in India care a lot about the wrong person getting the money rather than people actually getting the money who are entitled to, right? Is that they're linked to domicile. What is domicile? Domicile is that you have to have proof that you're the resident, you have lived long enough in each state. It's a second degree citizenship that we've created in the country. It's the biggest barrier towards accessing formal welfare entitlements. And it's a political dynamite. People don't want to touch it. But as you can see, it does, contradict Article 19(1) in the Constitution. And this is being brought up in the courts. And it continues to be a feature of state level eligibility criteria. And it varies. Somewhere it's 5 years, somewhere it's 10 years, somewhere it's 15 years, somewhere you need to own land, somewhere you need to renew every year. It's again a patchwork. So what happens? People don't engage with these things. People just, migrant workers and migrants and their families, migrant students, they all sort of IDPs, they all sort of just do things informally, right? And last point is, and the index will talk about this, is different states in India have taken initiatives to expand welfare, but they're quite fragmented. And the different policy areas we focus on in index, some states are doing better than others, some states are other. But the point is, it's a real patchwork. There are a lot of holes in this patch. And I guess the point of indexing is to reveal this, and is to suggest where something's working, something's not. It is not a criticism mechanism. It's supposed to just reveal the situation as is by framing it in this migrant context, right? So that's to motivate what we're up to here. Just to talk about the nature of initiatives for low-income migrant households. So at India Migration Now, we've done a lot of work with state governments, with central governments, with CFSOs. There's some fantastic civil society organizations, NGOs, who work on specific domains, or specific geographies, specific corridors. And we've had, real fortune to work with them, learn from them. And what we have sort of, from the work at Impacts and through our own experience working in the space, have sort of recognized is that there are three kinds of initiatives. The center and state governments come together. Central government might put on an overarching policy, like the Interstate Migrant Policy Act, now the labor codes, and then states have to sort of execute them, right, by making rules and implementing them, right? Maybe the financial allocation done by the state, and the center is matching it. A lot of labor-related, welfare-related pieces fall into this. Then there are pure CSO initiatives, and then there are initiatives which state governments require CSO help, right? And it's important to appreciate this nuance. Sometimes we just think in the world of state and central and CSOs all working independently. That is not how it works. In fact, most things are scaled with the collaboration of civil society and governments. Sometimes even private sector gets involved in all of this, right? But in the scope of impacts, this is what we have sort of recognized. Okay, now getting into impacts. Now let's define what it's. Interstate Migrant Policy Index is an index that ranks and compares the states of India with each other based on policies related to migrant integration. So I've tried to define each of these things before I come to defining impact. So hopefully that's clear. The rationale is to, as I've been saying, encourage states to take into consideration the following two principles while developing a migration integration framework, right? Well, one is to motivate them to have a migration integration framework, but then if they do it, the idea was, and comes from MIPEX, and I'll talk about how we utilize this and created the index in a second, but basically you have a principle equality, which is why we want equality of opportunity between migrants and natives, right? Migrants being an interstate migrant in this case. There are other kinds of migrants. They're intrastate migrants. They're intra-district migrants. They're all kinds, right? In fact, there are more intrastate migrants than interstate migrants. And that's the other part of the story. So we're talking about interstate migrants. So you're not a resident of the state you're in. which typically means you've been there less than a year, right? So we want equality in that case, right? The second is, even after you have equality, you need to understand that a migrant person is more vulnerable than a native. They don't speak the language. They don't have knowledge institution. They probably have a weak network. They probably don't have an address, for instance. So they have this additional vulnerability. So you need to also keep that in mind. So you can have on paper access to housing, which is equal for both. But if you're not actively sort of making people aware of it in a language which they understand, so you're not understanding the vulnerability that the non-native might have, right? So you need to take that initiative. So these two principles are the heart of where we're coming from in terms of how we evaluate, right? And we're evaluating each policy indicator on a score of 100. Each state is given a score, an average of 100. So how does it work? Let me start bottom up. So what do you see in front of you are policy areas and dimensions. I don't want to get into indicators. Indicators are a huge list of indicators. Indicators are basically a question. It's asking a yes/no question about each labor policy area and dimension, right? And so the way we came up with the list of policy areas was looking at, first of all, MIPEX, but then we looked at the literature on internal migration in the last 30 years in India. And we looked at the kind of policy areas, vulnerabilities that they were identifying. And it's from a fusion of those two places we came up with labor market, education, children rights, social benefits, political inclusion, health and sanitation, domicile identity, and housing. Right? So this was grounded in about 30 years of sort of meta-analysis of the internal migration literature. Then the dimensions come from very much inspired by MIPEX, which test the sort of the level of implementation, right? One is, are you providing basic access, which basically means, have you put migrant as a word in the policy? Like, are you saying that, okay, migrants I allow it, or you might be restricting it? That's the other side, which happens in labor market the most, is that they say, well, or education, it's like university scholarships only for domiciles, or university reservations are there for domiciles, right? You're limiting access to migrant students, right? Access to labor market. State jobs are only for natives. This happens. The reservations are very common in India. And these reservations often are pro-native, anti-migrant. Obviously, there's a political economy at play here, but it's restrictive. So you have accessibility, but you can also be restrictive, active discrimination. So this is where the first dimensions, access, most of the access, framed dimensions look at, right? Second is, okay, you might have provided some access. This happens in certain, for child rights, it happens, some education, primary education, which kind of overlaps with children rights. Some of the health and sanitation, some of the housing, you see, access is there, but then there's no effort made to facilitate, or very little effort is made. And facilitation could be, you have reached out to those communities, you have an outreach campaign, you made a fiscal allocation to that front. You made a fiscal allocation to promote that particular initiative in their language. You put billboards up, you do radio promotion, you do TV promotion, whatever. You made some effort, some facilitation effort, right? And then finally, like, what measures are you measuring this? Are you even tracking? Sometimes, okay, you put it on paper, you even put the ads out, but that's it. It's paper exercise. Are you even measuring this change? Are you updating it? Are you doing data collection? Are you engaging CSOs? So these are all sort of, measures to achieve the change that we're trying to intend here, right? So this is where the dimensions come from broadly. And then below each dimension, as I was saying, under are a list of a lot of indicators. I'm happy to share the indicators separately. By the way, this whole index is open source, available on our website. I'll talk about how to engage it more. But each indicator then gives you a score, right? And it's 0, let's say you have 0, or you're restricting, you have no access. It's 50. In fact, when we were doing it, we thought we'll do it like that. But in practice, we were like, okay, if there's no restriction, it's a 50. We couldn't give 0 for that. 0 was when you're actually putting restrictions, and 100 was you actually thought about doing something proactively, right, in the access. So we had to adjust the scoring because it was a dismal state of affairs in terms of what was going on, right? Anyways, the scores from the indicators are average for each dimension, and each dimension averages to a policy area, and each policy area gives you a state score, and all the state average gives you a national score. That's where the scores come from, right? So this is how a typical indexing exercise is done, and this is how you sort of ground a framework in literature and your principles. It's important to do that. Important to be super transparent, because you want this to be critiqued. You want this policymakers to engage with it. They should know inside out the logic of it, right? And I mean, I'm telling you, a lot of feedback we've gotten over the years. People talk about different policy areas, women-oriented, legal aid, which are very relevant, and it's something we hope to include in the future. Okay, so just to showcase what results look like when we do this evaluation. So the way in practice evaluation is done is that we look at the laws and policies for each state government in each of these areas, right? And then we map them, as we review them line by line, we look at the indicators and we test the policy document, the legal document. Finding documents is an exercise. We have a lot of legal interns and policy analysts who work together. We have to do RTIs to access these documents if they're not available. And that's how where some of, and then the indicators test each of the documents and we get our scoring from that, right? So it's it's all primary sort of pieces of evidence, which is the policy documents that we rely on, right? So to sort of create the scoring, and then it's about the interpretation and the sort of the reinterpretation, and then there are experts who validate the scoring. So we have this very process, the paper. There are 2 papers on this, all published. The methodology is very transparently put out there, and it's been peer reviewed. So that's where the scores are coming from. So there was a slight increase overall in the scores between 19 and COVID and then 21, right? And this is it was a coincidence that we did this pre and post COVID. So it was a very interesting piece of analysis we could do about the impact of COVID on policy making. So there was slight improvement overall. We reviewed most of the states, and you could see that the certain states who did very well, especially, but very few of the typical receiving states, the migrant destinations, did very well, except Kerala. We saw some promise amongst sending states, and I'll get more nitty-gritty into it, but just to showcase the overall picture, right? So now we get into policy area average scores, national average scores. So the light blue overall is 2019 impacts, and in the darker bar is 2021. But as you can see, overall, there was some marginal improvements in housing, in education, in labor market. A lot of this is driven by the other big change that happened in 2019-21 was the implementation of the labor codes. And like I said, it forced some of the legacy laws. Some states had to make the rules because they have a deadline on that front. And so I think some of it was driven by the labor codes. And there were certain things around benefits, around identity registration, health and sanitation. You can see the push. You can see the impact of COVID, right? COVID forced some of these state governments to enact laws and policy initiatives or schemes, sometimes something akin to an ad hoc executive orders, which they had to do because of COVID, right? Because they had to include migrant workers to access vaccination, healthcare. So this is some of the highlights that we have. So there were some yojanas in Maharashtra to increase the entitlement and sanitation services to all residents, all people who are present, which included migrants. Very famously, Delhi's Aam Aadmi Mohalla clinics were very, very oriented towards migrants. There was a big political motivation behind it, of course, but it was actually a very effective exercise on the primary care. And there was similar work in Delhi on the education side also, which goes on. It's not stopped with the government changing. It shows the power of creating something and then being very universal about it. Punjab improved in terms of their very important destination for migrants, especially from Bihar and neighboring states around Bihar in the agriculture sector. Rural to rural migration happens. And so access to entitlements, sanitation services, really, again, a COVID impact, and especially the execution of the Ayushman Bharat scheme were important pieces to Punjab's improvement. And then again, as an example, Gujarat adopted the occupational safety working conditions rules, which kind of made them, integrate some of the migrants. Again, in Gujarat, a very upcoming, very important migrant destination today. Especially Surat is probably one of the most important migrant cities in India. Moving on, on the education, children's right. So Maharashtra's Women and Child Department, who have interacted quite a bit back, have done a lot of great work under their Maharashtra child policy. They've executed projects to increase the access to migrant children and their access to their rights, to their entitlements, education, nutrition. They've actually done a lot of work. It's worth acknowledging within Maharashtra, district, a lot of work they've done on that front. And I think it's that intrastate work is also reverberating in the interstate awareness, which is very interesting. It's the incidence of migrant policy making comes from any direction, and it's important to keep in mind. This is why mainstreaming across the board is so important, right? There's some great work that Kerala has been doing for many years. Project Roshni is one of them, and it's an educational project. Kerala has an intensive migration today. Every state from India is represented in Kerala, and the Kerala government has a history of being very proactive on labor and children and education and healthcare issues. They have institutional capacity at the lowest level. Very trained officials, and I think it reflects on the district level, Ernakulam in this case, helping improve the education score for migrant children. So Delhi's score in this case decreased because they have specific restrictive policies they put into place for education, right? But Punjab's increased from 20 to 60, right? Because they sort of had crashes and primary education of migrant children, a lot of implementation work done on that front, right? So just to show some of the more children education, as you see, a lot of focus here is on primary education. You don't see much happening on secondary education, which is politically a lot more problematic for state governments. But that's where we see restrictions continue to persist and increase in some cases, right? And then we're looking at housing and social benefits. And so the PDS order in Kerala allowed the portability of ration cards. And that was the other big thing which has happened in India and generally was the portability of ration card scheme. It was a pilot which was expanded. Again, COVID was a motivator because ration and access to ration was so important. So Kerala's execution of that scheme has pushed its benefit score from 10 to 58. Huge change post-COVID. Access to housing in Tamil Nadu went from 50 to 100 because of the affordable rental housing complex scheme. So rental housing is a very interesting space because you will inevitably, especially affordable rental housing, you inevitably intersect with migrant, very lived reality. Housing is the most important thing, both informal and formal. And so the work done in Tamil Nadu on that front has been very important. And then finally, political participation, which is generally not thought about. And political participation in IMPEX is about the ability to vote in district election, because see, state election boards only focus on that. State elections are part of the National Election Commission. So, so here, trade unions of Adivasi migrant workers were created, which allowed sort of the consultative. We have a dimension around consultative bodies and indicators around that, which allow push the score up. So the formation of political parties for migrants, allowing migrants to run in elections at state, at district level. These are all kinds of initiatives and indicators we were capturing in political participations, and things which really very little work has been done on. So most of the states were zero, though there's nothing stopping people from changing their address on their election IDs from their host district to the state district, but they don't do it because they don't want to lose benefits and where they come from. So there is that tension on that front. While the facility is there can be a lot more done to understand and find ways where people can move it much more easily, switch in and out. So but that's those are the sort of things we capture in political participation and sort of creating a union of Adivasi workers in Gujarat. Not something you will clock in a headline anywhere, but it was clocked in our analysis and helped push its score up. Okay, so who's doing well? Report card. This is more to see the top 5 states. If you see, what's heartening is that we saw Bihar really jump up here. Bihar was nowhere near the top 5 in 2019. We saw Bihar jump up, which shows as a standing state, it is also doing things for as a receiving state. So we saw a lot of initiatives on that front. Assam coming up was shot up a bit. Maharashtra is important. We saw Maharashtra improve for the reasons we discussed. Child policy. Maharashtra is one of the most important legacy receiving states. Kerala being a relatively newer state, and Goa slight plateauing, and Rajasthan also plateauing. But again, top 5 performers overall. It's a mix of high sending states and high receiving states, if you notice here. Assam is both a receiving and a sending state. The bottom states, Manipur, so a lot of states in Northeast which have strong tribal community driven politics have land ownership as a domicile requirement, and they're quite restrictive at times, despite being very important sending states in their own right. So you see bottom 5 states in 2019, Manipur, Jharkhand, Chhattisgarh, Tripura, I would say all of them are typical sending states. Himachal is a mix, though it's becoming an important receiving state. It's very problematic that some of the standing states, we saw Bihar improve. You have the empathy to understand what your people need. You might think you would apply it to people who want to come into your state, but we don't see that here. And Odisha being there is again, Odisha is one of the most important sending states in the country, but not really thinking about people coming in. And again, it's important to impact and understand impacts is focusing on a receiving point of view. It's not talking about sending. It's looking at how you treat people who come into your state, right? So, little report card. This is today another data cut on just looking at receiving states. The top 7 receiving states. So we're looking at Maharashtra, Kerala, Delhi, Gujarat, Tamil Nadu, Haryana, Punjab. Hopefully the next census will give us an updated sense of what's going on this front. But based on the last census, these are the top interstate migrant receiving states. So we saw Kerala improve slightly, and we saw almost all the states, make improvements, which is heartening. And I think this reflects both the labor code adoption and COVID. And but still a long way to go overall, right? It should be seen as a baseline exercise to see where we are and how policies can shift in an event like COVID. All right. So key takeaways. We're getting to the end of this lecture. The pandemic pushed the states, like I was saying, to focus on areas like food security and health. These were almost emergency measures that they had to put in place, especially during lockdown. Universal health insurance schemes were expanded. The Ayushman schemes and their implementation, very important. But the utilization is low because awareness is low. So one of the vulnerability points is that when you're not in your home state or you're moving a lot, construction workers or migrant workers move a lot project to project, they're not aware of what they're entitled to. It's just a mystery to them. They know what they're entitled to, where they're from. They just don't know anything beyond what their contractor is telling them or employer is telling them. So despite the fact on paper the expansion is there, implementation has been measured to achieve change is low. So very interesting learning for us was when confronted with COVID-19, states found it easier to implement and expand the coverage of policies that were already in place. And this is what I mean, state of the art. If you have things on paper already, it's much easier to execute that than come up with a new policy scheme, right? So that matters. The other part of this is that if, let's say, Kerala is doing something, states can copy them. States compete. The whole federal competitive piece, which Niti Aayog has been very keen on for many years. I think is really important. If Kerala, or there was an MOU between Odisha and, and Tamil Nadu, which has been replicated by some other state corridors, right? That MOU was never really properly executed, but the fact that that existed, and we captured that in 2019, there were other states who recognized that, oh, well, they're doing it, we can do that too. And so I think Chhattisgarh, Jharkhand, they all explored the MOUs. And that just shows, that imagination is sometimes linked to what other states are doing, or something that's already on paper at some level of government within your own state. And that's more likely to happen than new ideas out of a vacuum, right? Because there's a degree of evidence behind it, and some legal language you can imitate and bring in, right? So that's why these kind of exercises, even though they're on paper exercises, matter. And the other is that you can have policy provisions, you can make fiscal allocations, you can think of things, but that doesn't necessarily link towards what the needs of your particular migrant population are. So that's also important and to recognize, which is why measures to achieve change and doing more evidential work on what people actually need is important, and which can feed into evidence-based policy making, right? All right. So recommendations. That's my very much at the end. So bilateral or multilateral mediation structures guided by central governments. So this is where I was talking about the MOUs that Odisha and Tamil Nadu have had. Now Odisha and Andhra. Odisha and Andhra did the first. Odisha and Tamil Nadu are done, and then now Jharkhand is also getting into this. Kerala is getting into it. So these are sort of things, perhaps even either bilaterally states can bring up, but even central governments can encourage between key corridors, sending and receiving corridors, right? Government, state government. This can even have a district. This can also happen at district levels. There's nothing stopping district in Bihar, a Madhubani in Bihar, and a Pune in Maharashtra linking together, or a Delhi, a Northwest Delhi, where a lot of folks from Darbhanga and Madhubani are there, and Madhubani government coming together and doing things, right? CSOs can be involved in this. So these kind of mediation, bilateral, multilateral structures are a very useful way to get ideas and services in a balanced way executed. The other part which we try and motivate is we need to move beyond just access and examine measures to facilitate access, awareness campaigns in migrants. This was during COVID. You're in Bangalore, and there are migrants from all over, but the announcements are happening in local language. So it's an oversight. And a closer look at how federal systems are responding to the issue of internal migration at different levels must be an important agenda for global migration governance. So that's the other piece. The incidents can also come if the migration policy agenda globally, the migration, labor migration compacts, and can also factor internal migration. We've tried to link this with SDGs also, but these things can seem very abstract, but actually have an influence when governments are trying to figure out how to execute something. If they have a piece of policy language available to them, they're more likely to adopt it. And the problem with internal migration policy is that there is very many governments to lean on. Kerala has to create things state of the art, or maybe repurpose what they've done for their native populations. That is not possible in other states. We don't have the capacity, right? So having things internationally framed or nationally framed matters. And again, that's what I mean by mainstreaming. Mainstreaming, that's why it's so important, and that's what the index is trying to achieve, right? Okay, just to now get into the more active things, you can, first of all, this whole index documentation paper is out there. It's on our website. You can download the scoring. You can look at all of it. It's available. And if you have any problem accessing, you can reach out to me. Not a problem. We're happy to always collaborate and make things available, right? So there's a best practice. There's a repository of all the policies. This is supposed to be a feedback mechanism. This is not supposed to be a critique, criticism, any kind of political criticism. It is just to showcase and how we learn from things. A lot of these issues, irrespective of who's in power, have been there. I don't think it's a party level problem or anything like that. I think it is very much us as a country learning how to build these policies, right? And yeah, it's a reference for locating migrants. There's one thing we realized in COVID was that At times people didn't even know what they were entitled to. So this becomes a reference for that. And it's also a way of tracking progress. We haven't done it for a couple of years. We hope to do it very soon, the next round. There's another way to engage with us is to participate in that process. We'll keep you posted when we start, but tracking progress and schemes across departments, ministries, and governments. And above all, especially at central level, it's a strategy tool. It gives you a strategic insight of what's happening in terms of migrants. So we hope in terms of the fiscal planning, strategic planning, governments at every level utilize it, multilaterals utilize it. So I'll pause there. Thank you very much. Hopefully it's been a motivating talk and I look forward to the discussion. Thank you.
So much for really, your detailed talk, and you very comprehensively took us through how IMPEX was conceptualized, the nitty-gritties of its execution, and also the results. Thanks for taking us through the policy. Your policy, your 8 policy areas, to the results of each of the areas. So my question to you is, when you did the exercise for the first time in 2019, and I think this was very, I'm not aware of any other such exercise. So such an exercise was done for the very first time in India. Did any of the results surprise you?
I think I was surprised by how absent-mindedness, when you had, for instance, the national education policy, which is out there, and it was more the central government. Somebody framed it that all children in that district need to have access to, primary education. They should be enrolled in that school, right? And so it's only when you start looking at the state policies and you see where they come from, you realize, wow, it's just because it was the central government dictating that they just did it, right? And it's not like there was any further fiscal allocation, because some states actually went ahead and said, you know what, we're going to try and do some awareness campaigns. We're going to try and do some data collection on that front. So I think what the first surprise was that it had to be forced. It was not a initiative of the state governments. We expected, when the state governments are thinking about this. But then second was, and this has become not a sort of almost an analytical takeaway, which I also shared earlier, is that the moment it's on paper, things happen. Some states were like, you know what, let's try and make this real by doing data collection, which hit multiple indicators in our analysis. So it was that kind of serendipitous, kind of discoveries, which was surprising, right? It was not surprising that Kerala did well, simply because Kerala has an institutional mechanism. But then to see Bihar do well, 2021, that's heartening. That's what we do this for, right? That's heartening. I'm not saying IMPEX is the reason they did it. They had their own other initial reasons. The other surprising part is the motivations. The motivations come from strange incidences. Sometimes some states like UP, Maharashtra care more about intrastate migration. They are very large states. They are not concerned about who's coming in, who's leaving. They're more concerned about intrastate. And that intrastate leads to interstate policy changes, right? Some care about women and children. Some care about welfare access. Some care about some other priorities. So Odisha is low, but Odisha cares a heck of a lot about labor. I have a very proactive labor department in Odisha. So, it comes from surprising incidences and then becomes mainstreamed into the broader, interstate policy. So I think these sort of things that surprised me. I don't think the rest of it was that surprising in terms of we expected it to be dismal because we could see what was there, what wasn't there already.
Was there any specific indicator that you wish to have included, but you didn't or couldn't because of lack of data?
Yeah, I think we would love to do maybe something more specific to women migration. I think there's been pretty critique given to us. There was criticism in terms of, is this how relevant it is for seasonal migrants who are moving all the time? So they're really active multi-locational lives. What can we do on that front? I think there I was struggling conceptually more than data. Like, how do I even frame it? It becomes so impractical in terms of policy, but perhaps we should have an indicator on that front. It's something we are considering. I think I wish I could do more in terms of how well these policies are actually being implemented in practice. That was the feedback we got from Niti Aayog, for instance, and we looked into, how the implementation can be measured. Very complicated stuff because the political economy there, and in technicality becomes very, very expensive. But yeah, those are sort of things. Legal access to legal redressal mechanisms was another big one. Very salient feedback from the community of lawyers we got feedback from. So these are some of the places we felt we could do more. Certainly, yeah.
Right, right. No, Varun, thanks. This has been most useful, and I think it will be very beneficial for our students, who spend a larger part of the course studying migration policy, studying, migration theory and the empirics of migration. So, I think your interventions of policy have been most helpful, and I think it really will be a treat for them to listen to your lecture, and I am grateful to you for taking the time out and doing this talk with us. So that was a very, very interesting talk by Varun Agarwal, the founder of India Migration Now. And he spoke about the index, IMPEX, the Interstate Migration Index, which is the first of its kind index that compares the various states in India based on policies that they have for migration integration. So as you saw, he took us through the history of index, the conceptual foundations, and he showed us the nitty-gritties of the ranking in the index. So, as it is with the construction of any index, you have specific areas. So, IMPEX has eight specific areas in which there were different indicators that were incorporated. And as you saw, these 8 areas all very important for migrants and for migration integration, which is the purpose of this index. The areas were, the first one was labor market, the second one was education, the third one was child rights, the fourth one was social benefits, the fifth one was political inclusion, the sixth one was health and sanitation, the seventh one was domicile and identity, and the eighth one was housing. So you see how all of these policy areas then had specific indicators based on existing data, and using these indicators, the index was aggregated for each state. So for some of you who might be in the process of doing research in the business of constructing indices, on the whole, this was one of the final lectures that largely talks about the policies around migration in India, and I hope you found it useful. Thank you.